Hi everyone. I thought this week's marriage therapy session was very much what I expected it to be. And our marriage therapy session was posted on YouTube at called Irreconcilable Differences, a Solution-Focused Approach to Marital Therapy by Kim Berg. I did think that Kim Berg, the therapist, was a little bit more passive than I expected, and then also the couple was a lot more involved than I expected. But after reading the chapters in our textbook is Family Therapy, an Overview, written by Goldenberg and other authors. It states that solution-focused therapy relies heavily on couples and families having their own innate ability to solve their own problems and troubles. So that's exactly what Kim Berg was doing. And then it also states that despite a therapist's education or expertise, a therapist's prejudgments cannot be considered objective or unbiased and must not determine the goals toward which the family therapy should be directed. So that was, it made a whole lot of sense after I read that. And then what behaviors or actions did you notice the therapist Kim Berg use, and how did the couple respond? I felt like the couple responded very positively to Kim Berg. I thought it was very effective for them, especially looking at the second session. I noticed that she seemed to set the expectation for change in a very careful way. She chose her words carefully. For example, when the couple started to talk about the things that were bothering them, and it was a lot of like talking about the problems, she redirected them by asking in a very, very careful voice, in a very kind voice, what do you suppose needs to happen, sort of looking back, say 6 months from now, 3 months from now, that this session at this time in this moment is a good idea, and that this time was helpful. And that immediately took their mind away from the problem talk to a more of a solution talk, which was quite genius, I think. And then also I noticed at the beginning of the first session, she opened it up with a very positive statement or question. She said, "Is anything better?" Which is another positive way to begin a therapy session that you hope to be more of a solution focus talk. I also noticed that she complimented indirectly and focused on their strengths and past successes, which is what our textbook also has talked about. She did a lot of reinforcing of change, and then I noticed that she paused a lot, but I think that gave them time to think. And then the last thing is what question would I have about this type of therapy? I'm curious about how she would approach clients that have a different sort of problem, like pretty serious pain from post-traumatic stress disorder, or possibly a death of a child. These are feelings that I feel like have to be addressed. You cannot go from, I don't know how you would go to use this type of therapy, because they have to have time to talk about their feelings. Also, broken trust from infidelity, the inability, a couple that can't become pregnant, the divisions that are in families. This is a great therapy. However, I think that there's sometimes a need for an apology. So that's all I have, and thank you so much.